My name is Maya Holleran. I am a speech language pathology assistant and a graduate student clinician. I am currently finishing my final clinical rotation at the Els for Autism Foundation and look forward to talking to you about speech language intervention via telehealth for children with autism spectrum disorder. For the purpose of this presentation, I will be using person-first language. I created this presentation with the hope that you will understand the general practice of telehealth, understand the benefits of telehealth, and how telehealth can be used for children with autism spectrum disorder. Throughout this presentation, we will analyze the process of a speech language evaluation and the process of speech language therapy via telehealth. I also hope to help you understand how to incorporate therapy supports and augmentative and alternative communication during speech language intervention via telehealth, and to understand the importance of parent and/or caregiver involvement in speech language intervention via telehealth. In the context of speech language pathology, telehealth is the process of providing formal therapeutic services remotely via telecommunication technology, such as on a phone, an iPad, or computer. Therapeutic services include, but are not limited to, evaluation, treatment, and parent training. Though telehealth can be used for a variety of services covered under a speech language pathologist's scope of practice, this presentation will focus on providing speech language services to children with autism spectrum disorder via telehealth. Much like anything, telehealth has both advantages and limitations. Some advantages of telehealth include access to treatment. Intervention via telehealth can be provided to people who would not otherwise have access to services. Additional benefits include a similar outcome as face-to-face intervention and the encouragement of parent and/or caregiver involvement in treatment. Some limitations of telehealth include limited computer and internet access, limited ability to operate technology, a parent and/or caregiver's inability to remain present throughout the session, a clinician's inability to find a private setting to host the session, and potential insurance barriers, as some insurance companies will not authorize therapy via telehealth. As the focus of this presentation is speech language service delivery via telehealth for children with autism spectrum disorder, I will provide a brief overview of both ASD and speech language pathology. Autism spectrum disorder is a neurodevelopmental condition characterized by the presence of restricted and repetitive behavior and difficulty with social communication and interaction. It is also common for children with ASD to have difficulty with articulation and expressive and receptive language. Expressive language is the sharing of thoughts, feelings, and ideas, and receptive language is the understanding of what others say. Telehealth has been proven to be an effective method of speech language service delivery for children with autism spectrum disorder. Speech language pathology is a profession concerned with various communication and swallowing difficulties. Areas within the speech language pathology scope of practice include augmentative and alternative communication, cognitive communication, feeding, fluency, language, social communication, speech sounds, swallowing, and voice. Prior to treatment, a comprehensive speech language evaluation must be conducted. During a comprehensive speech language evaluation, a speech language pathologist will conduct a parent and/or caregiver interview to gain information about the child's current communication ability and parent and/or caregiver concerns. We will also gather case history information regarding the child's birth history, medical history, current diagnoses, and developmental history. We will conduct formal and informal assessment procedures to gain information about vocal quality, speech fluency, play skills, expressive language, receptive language, articulation, and social communication abilities. Following this, we will interpret the assessment results and use such results to formulate treatment goals, plans of care, and provide recommendations. When conducting a comprehensive speech-language evaluations for individuals with autism spectrum disorder, a speech-language pathologist should evaluate core deficits commonly associated with autism, including but not limited to social communication and play skills. Formal and informal evaluation measures can be administered by a licensed speech-language pathologist via telehealth. Some formal evaluation measures include, but are not limited to, the clinical evaluation of language fundamentals, the expressive vocabulary test, and the Peabody picture vocabulary test. Some informal evaluation measures include, but are not limited to, a fluency assessment, a play assessment, and a vocal quality assessment. Although a reliable evaluation can be performed, a speech-language pathologist must consider the testing procedures when selecting an assessment to administer via telehealth. If the online version of an evaluation will not be utilized or is not available, a test with a limited number of manipulatives should be considered for ease of administration and increased testing reliability. In looking at the self, a limited number of manipulatives are required. Many formal evaluation measures are offered in an online format, and the use of an online format eliminates the need to adapt the assessment for delivery via telehealth. On the right is an example of the Peabody picture vocabulary test in an online format to be administered via telehealth. And much like the picture, if we were to administer an online version of a formal assessment, we would simply just display the online assessment without the need to make any additional adjustments. If a clinician is unable to administer an online assessment via telehealth, the protocol will have to be shown to the client by uploading it or holding up the testing booklet. And as looking at the client's computer screen is not always possible during an evaluation via telehealth, it's necessary to make adaptations to ensure the reliability of the assessment. For example, we can give the client control of the screen and have them touch or circle the correct answer. On Zoom, we would give the client control of the screen and ask that they turn on the annotate feature to touch or circle the answers they would like to select. Additional adaptations include simply asking the client's parent and/or caregiver to report the client's responses, but we must be aware of the diminished reliability of the assessment as we can't be sure what information the parent is relaying. Now we're going to move into speech-language treatment. So following a comprehensive evaluation process, the process of speech-language treatment may begin. Speech-language treatment is the therapeutic process focused on improving impairments and disorders of speech, voice, language, and swallowing. In preparation for a face-to-face session, a speech-language pathologist will coordinate with the client's parent and/or caregiver regarding the time of the session, prepare a designated space to host the session, and prepare physical materials such as a token board, test booklet, toys, and reinforcers. In preparation for a session via telehealth, a speech-language pathologist will coordinate with the client's parent and/or caregiver regarding the time of the session when the parent and/or caregiver can remain present, designate a private space to host the session, check the internet connection, prepare physical materials such as token board, a test booklet, toys, or reinforcers, prepare online materials such as service delivery PowerPoints and test booklets, provide the client's parent and/or caregiver with materials to utilize during the session like visual supports, and ask the client's parent and/or caregiver to gather highly motivating items, such as a favorite toy or snack. In a face-to-face session, the clinician can use materials in the room to their advantage for reinforcement. And as you could imagine, this is a little difficult via telehealth. Although the client Although the clinician can briefly dismiss the client from the place in which they are seated for a break or offer a computer game as reinforcement, it is also helpful to ask the parent to have some materials on hand. You will find that the client's caregiver will play a large role in speech-language treatment via telehealth. The client's parent and/or caregiver will likely provide technical support, provide clarification for the client and/or clinician if needed, relay pertinent information, support the implementation of teaching strategies, and provide behavior management support. Behavior management techniques are often implemented when speech-language services are being conducted via telehealth. The client's parent and/or caregiver can be trained by a speech-language pathologist to manage behavior, and evidence-based behavioral supports can be used via telehealth by a speech-language pathologist, and they can be sent home to be used by the client's parent and/or caregiver. Two evidence-based strategies I will highlight in this presentation include visual supports and token economy. A visual support can be defined as using a photo, symbol, or tangible object to communicate with an individual who has trouble understanding or expressing language. Visual supports can assist with emotion regulation, provide predictability, support communication, and increase participation. On the right is an example of a visual schedule, a first-then board, and a communication board. Each of these can be displayed virtually, provided to the parent, or held up by the clinician. A token economy is a contingency reinforcement system which encourages desired behavior. Much like visual supports, a token economy can be displayed virtually, provided by the parent, or held up by the clinician. And I wanted to note that all of the mentioned supports can be adapted to meet the needs of each client. So they can include pictures and words, or they can include just words. Now we're going to move into actual treatment via telehealth. Though there are many areas within the speech-language pathology scope of practice, I will focus on articulation, expressive language, receptive language, and social communication throughout the rest of this presentation. Just to give a brief overview, when providing articulation treatment, an SLP will focus on the improvement of speech sound production and increasing an individual's level of intelligibility. When providing treatment for expressive language, an SLP will focus on the improvement of an individual's ability to share thoughts, feelings, and ideas. When providing treatment for receptive language, a speech-language pathologist will focus on the improvement of an individual's ability to understand language. And when providing treatment for social communication, an SLP will focus on the improvement of an individual's use of verbal and nonverbal social communication. For example, eye contact, body language, or the ability to communicate in a social situation. You will find that a large component of speech-language treatment is data collection. And whether we are providing services in person or via telehealth, it is very important to remember that we do collect data. On the right is a picture of an example data collection sheet. When providing services via telehealth, a clinician might choose to keep track of data on the computer or on paper, and both are acceptable as long as the data is accurate and transferred to the client's session note. And data collection will allow the clinician to track and document their client's progress across treatment goals. Now moving into the teaching process. When teaching via telehealth, a speech-language pathologist will verify the client is attending to the computer prior to the administration of the prompt, utilize online tools provided by the telehealth platform, such as the laser feature, the whiteboard, or even the annotate feature I showed you earlier, incorporate photographs into online presentations, and coach the parent through the process of prompting at any level to assist the speech language pathologist during the session. I would like to just mention that prompting is the way a speech language pathologist will teach their client new skills. This evidence-based practice refers to the level of instruction you give a child when you ask them to complete a task. Depicted on the right is an example of the prompt hierarchy, with physical prompting being the most intrusive level of prompting and verbal being the least intrusive level of prompting. So what happens when a child isn't verbal? Well, we will still target many of the same language and social communication goals, but it is important to understand how to adapt telehealth practices to meet the needs of a nonverbal child with autism spectrum disorder. AAC can be defined as all of the ways we share our ideas and feelings without talking. Augmentative communication is used to supplement additional forms of communication, and alternative communication is used in place of additional forms of communication. AAC can be aided, such as using a communication board or a speech generating device, or it can be unaided, and the client and clinician can speak using sign language. So accommodations for AAC via telehealth include, but are not limited to, sharing the screen of the speech generating device, displaying a communication board, and using the annotate feature for prompting. On the top right is an example of a high-tech display on a speech generating device, and on the bottom is a child using a high-tech display on the computer screen. I would like to mention that a parent and/or caregiver would be essential in the process of treatment via telehealth. For example, the clinician will not be able to see the child's computer screen or provide a gestural prompt, and the parent would act as both a liaison between the child and clinician and a teacher of the concept. I would like to just mention that we have to be careful when we're instructing our parents and/or caregivers to be prompting our children through any process, AAC or not, as it could decrease the reliability of the treatment. So we want to make sure that the parent and/or caregiver is prompting only when we're requesting that they do so. So included on the following slides are examples of treatment activities that can be used to target any of the areas within the speech language pathology scope of practice. I am actually going to take you to an example that is on a website called Boom Cards. This is a personal favorite of mine as it is interactive and can target many treatment goals. I can target expressive language by asking the client to use an expanded I want phrase to request an item they want to put on the beach. For example, Maya, I want the red camera, and I would simply move the red camera to the beach. I can also target receptive language by giving the client control of the game and asking them to move items to the beach. For example, put the red and white chair on the beach, in which the client would move the red and white chair to the beach. I can also target something such as where questions and prepositional phrases. For example, where is the towel? In which the client would tell me its location, next to the sandcastle. We're actually now going to move back to the presentation so I can share some additional treatment examples. Reading a story is another thing I favor via telehealth. A clinician could choose to read a physical book, or they could choose to display an online version. And there are actually many books that can be found on YouTube in an online interactive format. I enjoy this task because it's also very versatile. Through story time, I could target one or two specific words to highlight on a client's AAC device. I could target a sequencing goal, such as what happened first, what happened next, and what happened last. And I could work on the expressive or receptive understanding of WH questions. I chose to display this specific worksheet because I wanted to demonstrate an additional way to make the session interactive. Say I ask the client a who question. I can type in their answer and have them pick the style of the font, the color of the font, and paste a picture of the book here, as this is more engaging than just asking questions. Video clips are also fun to use during a telehealth session, and we can tailor the video to meet the needs of the client. One time I had a client that loved Lightning McQueen, so we watched a Cars video to target his articulation goal. Each time he saw Lightning McQueen, he had to say lightning. His love for cars was an advantage, as L was one of his target sounds. This specific video I have displayed, I frequently use to target social communication because there is a wide range of body emotions and body language displayed throughout the video. I will typically play a short portion of the clip, pause it, and ask, is the dad listening or not listening? Or ask, how do you think this boy feels? I will play the video clip for you and just show you a small example. So I'll typically fast forward and ask, is this dad listening or not listening? And I might play it a little longer and ask, how do you think this mom feels? Happy or upset? And I would also like to mention that each treatment example I have showed can target a numerous amount of goals across the speech language pathology scope of practice. However, I'm afraid if I listed them all, this presentation would be incredibly long. So just to review, providing speech language services to a child with ASD via telehealth is a dynamic process. Successful service delivery via telehealth will include knowledge of the telehealth platform, adapted evaluation and treatment materials, parent involvement and collaboration, evidence-based behavior management supports and strategies, and extended preparation time. Now that I have provided a summary of the process of conducting speech language services via telehealth, I wanted to again highlight some of the key benefits. Reliability is a huge benefit, and although modifications sometimes have to be made, a telehealth evaluation typically produces very similar results as face-to-face evaluation. Service delivery via telehealth is feasible. Telehealth offers parents and caregivers an alternative method to coming into the office, which can be difficult with work, additional children, and other responsibilities. And it's also very accessible. Some people are limited geographically, and not to mention, it can be even harder to gain access to a skilled clinician with work experience in the field of autism. And we also have to mention the increased parent and or caregiver involvement. It is very beneficial to children who have autism spectrum disorder. So these are, I used some of these resources throughout the session. Our first example was from Boom Cards. Our next example was from Teachers Pay Teachers. And our last video clip was from YouTube. Some other really great resources are Google Classroom and TeachTown. I appreciate you taking the time to view this presentation, and I really hope you enjoyed it. Listed is my contact email, and these are my references.